kind of pivot yourself back. Your head's going to be back here on the pillows. Make you nice and comfy. Keep your knees bent for me. Are you filming me already?
Yes.
Up like that. Okay, you can just kind of relax that down now. Hopefully that's relaxing for you. And I'm going to bring the upper part of the table upward into a little bit of a semi-sitting position. There we go. You okay?
Mm-hmm.
I'm also going to bring the table up. To be for sure, I got to check this.
I think I was hung by my feet when I did it. Somehow my feet were elevated and my head was down.
I promise I will not hang you by your feet.
I'm trying to remember.
It goes like that. I didn't lock the table long enough.
Or maybe I was standing up with the weights on my ankles. But somehow I was supported in a way that stretched me.
Well, the way the stretching this does, it does intermittent traction.
Mm-hmm.
As you
Yeah,
saw.
I remember it cycled on and off.
Mm-hmm. This is so good for me to be able to practice this, guys, so thank you for that, and I'm happy to. So, I'm supposed to do start at 30% of your weight. That's the high end, and then cut it down to just about half of that. Good. Nice. This. We attach like that. Gotta reach between your legs here. I apologize. Goes like that. Very good. It's good. All right. And we're gonna attach this. Sorry. I'm not setting anybody up in this position other than Margaret just a moment ago at this table.
Well, I'm your ideal training person then.
Yep. Okay, so everything is set. Now I'm also going to give you, Don, here's your little auto stop button. If you get uncomfortable and need to stop the machine, push the red button for me. I am going to set you up on a short lumbar protocol. Don, if we said you weighed roughly 200, 30% of that's 60. You're done. I like this, the way it's set.
207 this morning.
All right. Now, can you push the little red button for me? Very good. And it's going to start going. Good. You can just rest your arm across, but put your hands across your stomach. You know what they recommend? I'm going to set this up because I want to practice with this once. Lift your arm up for me. Bring this up here. Okay, just like that. And you can rest it down. Slide up. Not as easy as I thought it was going to be. And this. Put that other arm up for me. Thank you. And drop it right over the. Perfect. You practiced at home, didn't you? I can tell. So that is to keep you from sliding down the table. Mm-hmm. Good. All right. Where we at? 40. Are you feeling the pull?
No.
Okay. You know why? It's because I got the table locked. So as soon as it goes to rest, all these little things to remember. Pause. Yeah. Now I'm going to start this again because I want to do it with the table unlocked. It doesn't go very far if you have the table locked. Oh, it was unlocked. Okay, good. Push the little red button for me, please, sir. Okay. Good.
You need some funny posters on the ceiling like the dentist has.
We have talked about that. Yeah, if we want to do something like that, or have a screen that's hanging down that you can watch
Yeah,
old episodes of I Love Lucy.
I guess it isn't all that long though, the treatment, is it, that you...
Probably 12 to 15 minutes, not very long. Now, are you comfortable hanging like that, or if you want, you can, okay, there you go. If you want to rest, good. I'm gonna step back, look like I'm taking care of my patient. So I'm also checking, this looks inch above that, perfect, that's exactly how that should be done. It's funny, having not done it, there's gonna be I need to write out a procedure, step 1 this, step 2, step 3, so that I remember how to do this. Okay, that's good, that's in good shape, awesome. Are you feeling the pull down there?
It's real light, but I can feel it inching something along.
Mm-hmm. Okay, that's good feedback. They actually say, a lot of times patients will say it feels light, but it's a lot easier to decide you need to turn it up later than to overdo it and have them screaming in pain on the table. And
I can feel it when it steps, but when it's constant, you almost can't tell it's even there.
Yeah.
But I can feel each increment, I guess, of movement of it. So I can tell it's moving something, but I don't feel any like dramatic load.
yeah, and you're not supposed to. But in your case, if you're not real acute, I probably would run it a little bit higher. There we go. I appreciate you doing this. This really helps me in a number of ways.
I'm happy to be helpful.
It helps me to know how to run the table.
Yeah, we're
And we go, was the belt comfortable? Uncomfortable?
yeah. Okay. No drama with it.
Now lift up this arm for me. I'm gonna take this out from under your underarms. And go ahead and do the same you already did. Like I said, you practiced at home, didn't you? All right, so I'm gonna let this down.
Lower the knee thing.
Yeah, I'm gonna do that once I get you down to bottom level. Meanwhile, you got some support. Beautiful. There, and bend your knees a little bit higher for me. And then that goes. And to get up, I'm supposed to grab you like this and bring you that way. All right, sir, you're healed.